Hi, I am Sridhar, physiotherapist doing masters in RS College of Physiotherapy. Now we are going to see about presentation on gut-brain axis, vagal-bone interaction, and the effect of exercise in irritable bowel syndrome. Irritable bowel syndrome is a functional gastroenterological disorder characterized by a range of symptoms including abdominal pain, bloating, diarrhea, and constipation. The incidence of irritable bowel syndrome is 4.1% worldwide, with women being more affected than men because hormonal factors such as estrogen contribute to the physiology and pathology of gastrointestinal tract, being involved in the regulation of motor and sensory function. This interfere with gut-brain axis pathway and promoting changes in motility, visceral hypersensitivity, permeability, and immune activation of gut mucosa. The key feature of IBS is disturbed autonomic balance, which is characterized by a reduced vagal tone and reduced parasympathetic nervous system activity. Now we can see in the figure the stress induces in the brain the causes peripheral nervous system activity reduces and that causes intestinal permeability increases and the secretion increases. That leads to reduced fecal microbial diversity and that causes inflammation and increased IBS symptoms like pain, visceral hypersensitivity, diarrhea, constipation. That causes decreased pain threshold, increased anxiety, depression, stresses in the brain. Chemicals released by the gut microbes can influence brain development starting from birth. The gut-brain axis is a bidirectional neurohumoral communication system. It is important for maintaining homeostasis and is regulated through the central and enteric nervous system and the neural, endocrine, immune, and metabolic pathways, and especially including the hypothalamic pituitary adrenal axis. The bidirectional communications is done by immune, endocrine, humoral, and neural connection between the gastrointestinal tract and central nervous system. More research suggests that gut microbacteria influences functions of the brain by releasing various chemicals. These chemicals are transported through via blood to the brain and impact different metabolic processes in brain. There is n number of medication treatment for IBS is presented today, but physical activity have the positive effect on IBS. The physical activity modifies the gut flora, lowering systemic inflammation and enhance gut mobility and mental health. Through that, intestinal transit time increases and short chain fatty acid production improves and modulation of immune system happens that improves the IBS and improves the composition of gut microbiota, reduces pro-inflammatory kinase. This composition of gut microbiota is significantly impacted by aerobic activity, which is especially advantageous for IBS patients. According to many research and studies, aerobic activity can boost the diversity of gut microbiota and increase the growth of good bacteria. This study is aimed to find the connection between gut-brain axis and vagal tone and the effect of exercise in irritable bowel syndrome. Many research articles published about influence of gut-brain axis in irritable bowel syndrome. This study may help to guide the physiotherapists to treat IBS and to learn importance of vagal tone and gut-brain axis in irritable bowel syndrome. The aim of the study is to investigate vagal tone interaction and effect of exercise in irritable bowel syndrome. The objective of the study is to evaluate the effectiveness of gut-brain axis, vagal tone interaction, and the effect of exercise in irritable bowel syndrome on vagal tone by heart rate variability, pain by numerical pain rating scale, Psychological symptoms and fatigue by fatigue impact scale, IBS symptoms by irritable bowel scoring system. The hypothesis is to have null hypothesis or alternate hypothesis. Either there is significance in gut-brain axis vagal interaction and the effect of exercising irritable bowel syndrome, or no significance difference following the gut-brain axis vagal interaction and effect of exercising irritable bowel syndrome. The study design was experimental study. The population took as a irritable bowel syndrome patients. The sample size is total 24 subjects. Study duration 6 months and treatment duration is 6 weeks. In the variable, the dependent variables are pain, quality of life, vagal tone, psychological symptoms, and fatigue. Independent variables is aerobic exercise. The inclusion criteria are ages between 19 to 25 female subjects only. Mild to moderate IBS based on Rome 3 classification. Exclusion criteria. Excluded male subject, cardiovascular disease, diabetic patient, autoimmune disease, asthmatic condition, mental disorder, renal failure, neurological or musculoskeletal disorder. 24 female subjects with irritable bowel syndrome were taken and test was done before and after the treatment through the numerical pain rating scale, heart rate variability, and fatigue impact scale, and irritable bowel scoring system. The aerobic exercise can give given 20 to 30 minutes per day, 3 times a week for 6 weeks. Implementation of aerobic exercise into daily routine of IBS patients can start with a simple moderate impact activities such as brisk walking and cycling. Spindle et al. Uses numerical rating scale to measure the pain levels in the IBS patients. Nicholas Downs et al. 2024 uses IBS questionnaire to measure the IBS level. Link et al. 2013 uses fatigue impact scale to measure cognitive function, physical function, and psychosocial function. And Morris et al. 2022 measures heart rate variability for ANS efficiency. The subjects were treated with moderate aerobic exercise for 3 sessions a week for 6 weeks and continued daily activities before starting the treatment. Pain was graded by numerical pain rating scale. Vagal tone was assessed by heart rate variability. Psychological symptoms and fatigue are assessed by fatigue impact scale. Quality of life is assessed by irritable bowel scoring system. The measure was repeated at the end of the treatment session. After the analysis, the graphical representation as shown. NPRS was decreased, it means pain was decreased, and fatigue impact scale also fatigue reduces. Heart rate variability increases, thus the increased peripheral activity and reduces IBS symptoms. In discussion, we can see various authors what they concluded in their research. Classes et al. Aerobic exercise has shown to reduce symptoms of anxiety and depression. Dalton et al. Shows aerobic exercise exerts efficient effect on gut microbiota. Focused et al. Demonstrated that aerobic exercise can increase the diversity of gut microbiota. Gonastri, aerobic exercise also exerts significant effect on immune system. Camler et al. Shows sex hormones interferes with the gut-brain axis pathway, promoting changes in motility and pH permeability and immune activation of gut mucosa. The result of the present study shows there is a clinical significant difference in vagal tone, pain, IBS, and psychological symptoms. Now we are in conclusion. In part, the study was conducted to find how alteration of vagal tone affects gut and brain and affects aerobic exercise on irritable bowel syndrome. From the result, it is concluded that there is a significant improvement in IBS symptoms following aerobic exercise among women. The impact of exercise on the gut microbiota in IBS patients is promising area of research with significant clinical implications. Aerobic exercise offer benefit for good health and symptom management in IBS. We can also focus on mechanism behind hormonal imbalance with affect gut-brain axis and find optimal exercise to regulate hormones in future research. And in this study, there is a limitation only women taken because there is more incidence in women presence. And this is a short-term study. In this study, we suggest that similarly carried to larger sample size and different age groups and carry out other neurologic conditions to improve cardiovascular fitness and pelvic floor health also. Thank you and God bless you.